let's head to the Zoom room. We're here for our Wednesday check-in. Speaker Therese Terlaje. Good morning, Madam Speaker.
Good morning, Chris. Good morning, Sabrina. Good morning, Jason, and all of KUAM. Good morning, Guam. Off a day.
Off a day. Well, I know that Bree had probably some questions about the hospital hearing, but I wanted to ask if we could start with the human remains that were recently discovered.
Yes, I was just informed that there were some more human remains found up at the area that used to be the village of Sabananfadang, about 100 meters from where those other burials were found. And so at least one burial so far, and now they're going to do that surveying where they measure out certain number of feet from that site and look for more. But yeah, it's disturbing because it's the same area. It's the same part of the ancient village that was known prior to all of this construction. So they're pretty confident that this is a Chamorro burial, and so unlike some of the other burials that are found where they spend a lot of time trying to figure out who they are or who they were, these ones I think they're pretty confident these are Chamorros as well, just like the others, the 12 other persons that were found 100. It's all up there at the base that they're constructing in the Finnegauden area. They're pretty much cleared. It's all cleared. There are patches of land that are not cleared, and I guess this was one of them that they were beginning to clear when they found these burials. So I'm hoping that, of course, they will preserve these in place. But it really brought to my attention that there are other, so those areas, Magua and Sabananfadang, they're pretty much cleared with very few exceptions of patches of land where they might have found human remains, and so those patches are not entirely cleared yet, although Magua is entirely cleared. But there are other areas that I'm concerned about now, including Andy South, that they're doing construction up there at Andy South. Mogfog, they've also had significant findings up there, including, Lati, of course, and I think human remains, or I know human remains. And so we have asked them what their plans are for this area. If, I'm asking the SHPO if they're going to, have them preserve these in place, stop the construction, and at least the portion where they are finding, making the bulk of these findings. And the other area of concern, of course, is that the fifth firing range, the largest one that's supposed to be 59 acres just by itself in that complex of 5 firing ranges. So in that area, that construction was put on hold for a while, but in the interim, they've been doing surveying of the area, archaeological surveying. And my understanding is that they have made significant findings in that area as well. And so I am hoping the SHPO is going to discuss this with the governor and all of the senators, and that we can come to some kind of understanding as to how we would like to ask them to proceed or not proceed. I think according to the SHPO, the findings are significant enough that a pause should be considered again for that area. Not even a pause, an avoidance of the area, in fact. So those are the burials, yes. And so that's all I know so far. The Andy South, some people refer to that area that I'm talking about as Mogfog. And so we know from, again, the maps that there were people who lived there in ancient times, and they are also, just families whose history traced from that area. Some of these burials that they're finding, interestingly, are carved into the limestone. And I don't know, I found that it's a unique up there in the north, of course.
Speaker, we're going to ask you to hold real quick. I hope you have time because we're trying to figure out, are we good or what? Because I'm good in here. I don't know. Yeah. We're good? You sure? Okay. Speaker, are you there?
Yes, I'm here.
All right. Bree, are you there?
Oh, I'm here.
Okay. Okay.
Bree.
Good morning.
We had a temporary existential crisis.
Yeah. Speaker, before we get on to the other things, I just got to say, I mean, burial after burial, and it's the same thing. You know, we get upset, make some noise, and then it's just on to the next one.
Well, this is the thing, right? It's like, this is what I'm trying to change. Well, at least for me, I can only speak for me, but what I'm trying to change is how the SHPO's office and how we on Guam treat these burials, and how we should know if these are ancient villages already recorded on Spanish maps from 1940, prior to 1944, obviously, that these are areas that we should avoid. And it's this avoidance that I really think is being overlooked. It's really what's supposed to happen, of course, for historic sites. I don't think you're going to find any other place where they are so rampantly, doing construction over ancient villages. And so this is, I think, we all have to work together to stop this. And I'm trying to do my part by sharing the information, by making sure that people know, what's up next, and that we can try to put a pause on these things if we can. And avoidance is supposed to be the theme of the programmatic agreement, where we avoid historic sites. But what we found is that really that's not how it's working. What they're doing is removing and cataloging, and that's not correct.
So there was a hearing yesterday with the Guam Memorial Hospital, right?
Yes. So we had a roundtable with them. We wanted to get updates on, of course, the capital improvement projects that need to happen up there that have been, we've been following up on these for maybe the last 4 years now. And so we got an update on the electronic health record system, the roof repairs, the HVAC systems, and other CIP projects. And also, of course, I heard the minority leader earlier say that, so they reported to us that they had received significant amounts of federal funds, including, I think it was 26.5 million they received during FY21 in federal funds, and they are slated to receive 7.2 million in ARP funds. And that was news to us that they said they had signed the papers, and that so the money would be transferred to them soon. And they were going to use that for vendor payments. We also talked about, of course, their capacity. So they showed us the capacity and how they've been able to, convert existing rooms to COVID capacity and other capacity type. So most of that was by changing the air systems and allowing for telemetry in those units as well, by changing out the power systems. And so their maximum capacity is 161 patients. They're right now at 167. So that's significant. Also, you've heard them announce that they've cut off the elective operations, and that's because they want to use those rooms as well, and they're going to only allow for emergency operations. So capacity remains a big issue, right? And so they did acknowledge that they intend to use this hospital for the next 5 to 7 years. So they are actually investing significant amounts of money in things that are needed immediately. And so, we talked about the details of those upgrades. We also talked about the monoclonal antibody treatments. So that was my question. And I really wanted to know how these were being dispersed and if there was any type of priority system or not, because of, we didn't seem to have enough, right? And I think the shipments, because of the, some of the failures in the shipments or the storage, all of that, they really received just a little bit. So now they've received a larger portion. But according to Dr. Jolie Nuggan, most of their antibody treatments are being transferred to GRMC, and they are referring people up to GRMC for the transfusions. And they only are doing them at the hospital for those who are, in their ER, in their units, and some of the pregnant women, other people who, but on a very limited basis is my understanding, and the rest are being referred up to GRMC. So this is interesting because we have the testing sites, and we have I guess a doctor at the testing sites who's going to be referring people for this treatment. We also have private clinics who, when they test somebody positive and believe that they are high risk, should be referring them to these treatment centers as well. So what between the public health oversight hearing and this GMH roundtable, it's a little bit confusing because of this distribution of for example Regeneron or the antibody treatments. We want to see these treatment centers stood up as soon as possible. They talked about like they were going to do it last week. I think we really need these out in the community. We need them to be accessible when they can do the shots instead of the transfusions. Of course, that's much more accessible for people, and it's going to be faster and probably safer for the personnel who are working in those places because of the limited amount of contact. But still, I think this is related to just getting that detailed information out there, and I'm concerned about public health's ability to stand these up quickly enough. I want to commend the mayors for their efforts to encourage testing of their villagers, and to make sure that the testing, the mayor Alec has been a big advocate of testing in their villages. So I agree that all of this should be done in the villages. This is what we discussed in oversight hearing last year, maybe a year ago. Exactly. We had, public health and the doctors in there talking about the ideal situation if we are having COVID positive patients is to treat them in their villages, like make sure that they get what they need, make sure they get the oximeters, and make sure that they can be seen if necessary. If they have questions or they're not feeling well and they're not sure whether, they need to go to the hospital or something, that people can take a look at them more immediately. I think we need to, of course, just keep on doing anything we can to make sure we don't overwhelm the hospital, but more importantly, that these people don't suffer and that they don't die, right? Just from not being seen, or somebody not telling them, no, this is serious, go in. So of course I commended Dr. Uggan during the hearing for the detailed information that she gave us in regards to the symptoms that you're going to see on what day and that. And I asked them to continue to give this information. I think the information that we can give to those people who have symptoms, those people who are testing positive, tell them how to, react to any kind of changes, that the more the better. And so that's why I saw the mayors had, in addition to the phone bank that they're doing, that they've also sent out letters and flyers to some of the villages. So I don't think all of the villages have done that, but some of them have. So I think they're trying to be proactive. Right. And I'd like to also encourage everyone to go get tested. And so it's very unfortunate that the testing sites are closed today. That was bad news, I heard, just while waiting on your Zoom channel here. But that's really bad news, because I think there are a lot of people who still need and want to be tested, as we have seen every single day. Yeah. And I was very glad that they had opened up more sites for testing, including the southern site and the clinics, and they sent out lists. So the information's getting better. And as you see, they also sent out information. We've been really pushing them for more detailed information as to these COVID positives, the deaths, of course. We want to know as much as we can so that people can alter their own behaviors. They can know exactly who's at high risk. It sounds, and how they can alter their behavior now so that they can, either be seen promptly or just make sure that they don't wait too long.
Thank you, Speaker. We're gonna jump over the top of the hour, but I just wanted to get this out, guys. There is testing this morning. If you were planning on getting tested at TGen, that's been canceled. So is the testing at the Northern Public Health. But the Southern Community Health Center, just WhatsApping here with Mayor Ton Chargaloff, they will be conducting testing 9 to noon at the Southern Public Health Center.
That's great news, because on their schedule, they're closed today. That's great.
Yeah. So that's coming from the mayor. And
You can also go to the Tier 2 clinics.
Tier 2 clinics, that's right.
Yes.
Of course, because a lot of people want to get tested. It's unfortunate that we get this weather when the mayors are really doing their outreach and they're sending the letters out to everybody encouraging people to get tested. And I really hope it's not one of these where we cancel it because of rain in the morning and then the rest of the afternoon is like the most beautiful day, because I think that's happened a couple times. Guys, on the Breeze side, we're KUAM FM in Guam, 93.9, brought to you by Pacific Points, Calvo Enterprises, IT&E, and Jack in the Box. Let's go ahead and pick everything up and fix your hair, everyone, and we're going to go over to KUAM TV, where the link will continue right now. Good morning, Guam. It's 8 o'clock, and good morning, KUAM TV, our Thunder Buddies this morning. We're, this is the link. It's Pacific Points, Calvo Enterprises, IT&E, and Jack in the Box. Coming up, Superintendent John Fernandez. Also, the FSM Consulate Office will do the greater good with the Breaking Wave Theater Company, and a little more with Guahan Sustainable Culture. That's all coming up here on the link. Miss a link, miss a lot. So don't miss it. Right now, though, in the KUAM News Zoom room, we have Speaker Therese Terlaje standing by. Sabrina Salas-Mantanani, good morning.
Good morning. Speaker, I wanted to follow up on what you talked about regarding the disbursement of RegenCove. And you mentioned that GMH was giving a majority of the vials, the monoclonal antibody treatments over to GRMC. Did they provide a reason why?
Limited capacity in their emergency room, and that they just can't be doing those transfusions. Those transfusions, my understanding, takes about 4 hours, and they're already almost always at maximum capacity in the ERs, so they are referring them over to a transfusion center at GRMC.
I see. And also, was there any clarity in terms of, do they provide any of the RegenCove to public health, or is public health receiving their own shipment?
Yeah, I had asked that question because I wanted it to be very clear. It was not clear. So it sounds like GMH is going to continue to receive its own shipment, whatever it orders. And it will share its shipment with GRMC. And then public health, I can't confirm, but the way they described it to me was that they were also ordering from HHS, and that this was the only place that they could order it from was HHS, and that they would be receiving their own shipments, standing up their own treatment centers, and distributing those out to other clinics as they saw appropriate.
Mm-hmm. And you talked about how they're packed capacity, the but the overall census was 167, but the capacity at GMH overall is what 160. What about the utilization of the skilled nursing facility, and also the transformation of one of the wings into that alternate care facility? Right.
As you know, they've been that's always been part of the big plan that I saw like maybe 2 years ago now. No, before COVID hit Guam, we looked at the plan, and the skilled nursing unit was always supposed to be the pandemic location. Finding out that the HVAC system was absolutely not appropriate. They did a lot of work to convert up there to allow oxygen for the rooms, certain rooms, and so they've been doing different conversions and different upgrades for the last year that we've seen. So currently, they're trying to do the third wing and make that also the HVAC system, that they're all separated so that they can bring in patients without the risk of spreading the disease. So they're still working on that, but I know that they do have some patients up there.
Mm-hmm. What about,
they did, I'm not sure as of today.
And what about, I remember last year that when they were using the SNF, they had to move all of the patients out of the facility, and they were, I guess, across the street, maybe Catholic Social Services. Is that still the case, or has everybody been moved back to SNF?
I don't think everybody's been moved back. They've changed, but it was supposed to be the COVID unit, right, or the COVID location. So that's totally changed. Now it's the opposite. GMH is the COVID location, and the SNU is supposed to be the non-COVID for now. They're trying to make permanent upgrades so that it will be the permanent COVID location in the future. Not COVID, but pandemic or this type of
the alternate care facility. Right?
Yes. So ultimately, that's the goal for it. But right now, it's not. So it's the non-COVID. Some of these people who were in the hospital or SNU at that time are still, or were still in either GMH or St. Dominic's. And so I think they've been really trying to work hard on some of these really long-term stays, patients, find them families or other means of exiting the hospital. Sometimes that's really the issue. Otherwise, those with, it's just a matter of who needs that type of service, it looks like.
What was the update on bringing in medical officials and medical help from DOB?
It sounds like it's a large part of their, applications for grants from FEMA. They're also using other federal, so they multiple sources. That's how it looked to me during the presentation. They're using multiple sources to bring in traveling nurses, physicians, and other medical personnel. So it still seems to be a big priority because of the amount of finances that they are dedicating to that. And of course, we've always known that the capacity at GMH is very much dictated by the amount of staff that they have to service, to take care of the beds. And so it sounds like they're continually to try to bring them in now. Yeah. Bring more in. I think they have some right now. They it revolves.
Did they talk about the staff infections and resignations of physicians?
We did not talk about that during that hearing yesterday, but no, we didn't. Just how most of the staff have been working on. It's interesting. Some of the projects, for example, the electronic health records system, they said has been put on hold. It's a brand new system. We've got a brand new contract, right? So they're supposed to be converting to this new system, but that's been put on hold. And that's because the staff that works on that project has been transferred back to the floors. That's how they describe it, right? So a lot of, we heard that several times for several different projects, that these staff are so critical and that they are needed on the floors. So that's the number one priority right now, because their number of patients is so high because of this surge that they've had. And they've been on a surge of regular non-COVID patients, even prior to this COVID surge. So it's a very concerning. Guam, we have so much to do in regards to improving our overall health and reducing these comorbidities. Still much work to do, but I want to praise the staff at GMH, the nursing staff, the professional staff for their care for these patients. We hear a lot of stories about how caring the nurses are, to these people who are shut off from their families while they're in there. So I want to thank them for their patience in that regard and their dedication, perseverance. Really, it's been a long time now.
By the way, do you still have your weekly meetings with the governor?
Yes.
You do? Have you got? When was your last one? This past Monday, or?
We switched them to Fridays, and so we had it last Friday. Yes. So it's just me, the mayor, the president of the Mayor's Council. The Chief Justice is now joining us again. And they're pretty much COVID centered. So those meetings are COVID centered, and just to pretty much receive from the governor news of any changes, any potential executive orders. So I think everything that was discussed in the last meeting about now, and there's nothing that hasn't been implemented, we pretty much get it, and then they're implemented either that same day or yeah.
And,
So
but in terms of like restrictions or anything like that, no.
I know she's very hesitant to close schools, close businesses. She's very, very hesitant to do that. I asked straight out, if you hear a lot about the bars or the karaoke bars in particular, and I'm like, well, can we just do something in particular with those businesses? But I haven't heard anything. I'm thinking if she's talking about 18 to 39-year-olds who should be tested more often, or even just be tested because they're, the higher risk because they're more active, then more exposure. Maybe I don't know. I think maybe we can incentivize that age group some more to be tested, and so that they will know. And but I do like the every story helps. I think every family's story helps to inform other families, right? How did your family get COVID? It was one person who came home with it and spread to the entire family. And those stories, I think, are very effective. I have 11 siblings, right? Or 10 siblings. I'm the 11th, but I am so afraid of being the one to bring it to one of, the siblings, and then it creates a huge thing, or to let it get to my dad, who's already 87 years old, right? So all of these things, and I just think that's why I appreciate what you guys do, spreading the stories of these individuals and their families, the suffering that happens and the separation, and really such stress that happens when someone has to be hospitalized. And so I've also tried to stress this with public health, that if they can tell us exactly where these incidences are occurring, or, who are the businesses that are not complying. And I know that they were on your show yesterday saying that they haven't been able to catch, non-compliant businesses that we've seen.
What do you think of that, Madam Speaker? So they basically, Lonnie Navarro, who's heading up environmental health, said that when they go into these bars, they basically just ask the bar, like, hey, are you guys checking the stuff? And they're like, yeah, we are. And they don't do like a more thorough check, right? Which kind of made me wonder, like, why do we have these fines? And I mean, is that why no one's getting fined, is because they're not really checking? But in the event of a private event, they will go in and like ask everyone for their cards and the papers and all that stuff. So did you think that there needs to be these mandates, and especially the enforcement of them? Do you think it needs to be more evenly applied or more like thoroughly done?
Of course, if those mandates are truly, effective, right? And so, yes, if the mandate is effective, for example, keep your mask on, no being in the bar without a mask, then if that's an effective mandate, then yes, it should be enforced, absolutely. And that's supposed to be the premise of why these businesses remain open, right? That we're allowing you to remain open because you're going to follow these rules and require people to wear masks, for example, reduce the spread that way. But yeah, so those types of mandates, yes. And public health, yeah, I mean, we've seen it, I hate to say this, but they're so overwhelmed even up to now, even after the federal funds have come in, even after, oversight hearing after oversight hearing, demanding, how are you going to increase your long-term ability to do exactly that, to enforce, the regulations that you are imposing on people. How are you going to enforce that? And how are you going to ensure that I am safe in a restaurant versus, not, right? And if we're not, and that's what it really, so it's a matter of, unfortunately, I haven't seen this. They've done some hiring, but it's not what I had expected. I expected they were going to build up an entire new unit, right? That was going to be able to go out there and enforce, to trace very promptly. And as you know, right now, the tracing is kind of way beyond our capacity. Yeah. So those types of things are very concerning because, I just feel like I don't want to go around in circles here. We have to be able, we know what to predict. I think, that we're going to have to trace. We're going to have to know which businesses are not compliant, or we're going to end up shutting all the businesses. And if no one wants to do that, then you absolutely have to regulate the ones that are being opened, or that are showing risk. And the showing risk is a whole other issue, right? So I've been trying to get more details as to show me why you say the karaoke bars are the higher risk, right? Why do you say that? What are your numbers? Which parts of these numbers that you're releasing are from karaoke bars?
Yeah.
It's not clear. And so that's why I want them to be crystal clear, because I think people are so smart, they will take that information and be able to convert their behavior.
Madam Speaker, with the karaoke bars, I'm not sure what was reflected in the numbers, because I know when they do the data, they don't put like karaoke bars, this many cases.
No.
But in having Chima on, I mean, for the whole year, there were a couple instances, there were a couple karaoke bars that were involved with clusters. There was one earlier this year, and then there was one more recently, where the bar owner of this karaoke bar didn't want to provide the contact log and didn't want to provide who was there. And so that's why they say the karaoke bars, right? And then I think they say the bars in general, because if it's the 18 to 39 that are supposed to be driving the surge, then they're probably the ones that go to the bars. But I want to go back to the mandates. You said something where if these mandates are working, then they need to be enforced strictly. I just want to ask you, do you think that these mandates that the governor put in place weeks ago are working?
Well, we've seen, I think, since then that obviously the vaccine mandate is not going to reduce the transmission necessarily, that people who are vaccinated may also transmit, right? Or be carriers and transmit. And so that message, I'm hoping, has been changed. And so we treat everybody as potentially able to transmit this disease. And so we have to prevent the transmission of the disease by preventing, transmission of air from, body to body. And that's really the issue. And so those mandates, that's why I talk about the masks. I talk about, social distancing and the masks, and really, I see it all the time. I even walk the beaches to check the beach. The 2 months crowded, right? So I try to walk it and check who are these people and what are they doing, pretty much just to get an idea. And of course, a lot of them are young people, but we still like to be close to each other. So everybody's close. So it's there's always a potential, and that we just, I don't know, we have to be careful, whether it's in a bar, outside a bar, anywhere. We have to just be careful.
Right.
If you want to prevent bringing it home to your family. There was a couple other things that came into our office this week, including the new revenue report, and that's for FY21. So we're now in September of FY21, right? The last month of the fiscal year. So we got the report that covers August, and it shows that we are looking now at a $48.8 million more in general fund revenues over what was adopted in the FY21 budget. I know that sounds surprising, right? Given all the instability that we've had in our businesses. However, 48.8 more in general fund revenues. This includes, of course, income taxes. And so PUA really helped this amount come in. But in July, when we were looking at the report, we were only looking at 22 million. So we made an amendment during the budget law, right, that would take 20 million and put that towards tax refunds right now during FY21. So it was good to see that the actual collected revenues are actually much higher than 22.3 million that we were looking at back then, and they're now looking more like 48.8 million towards the end of the fiscal year. So we've got about 30 more days to go, but I think we're pretty safe to say that 20 million can be added to our tax refunds account in order to try to catch up with those refunds and clear them all out. We still have about 6,000 pending to be paid, and the same amount to be processed and then paid. So I think this would be a very good use of this money, and to make sure that happens. The other thing that we heard, of course, you guys reported on this, was the Medicaid changes for going forward. And that's good to know. We didn't know that when we were doing the budget. So what happens is Guam can access $133 million in federal Medicaid funds for FY22. This is, but we've in our budget allocated about 13.7 million, right? And that will get us, we have to match these funds by a percentage. So right now, based on the new percentage that we have, our 13.7 million is going to get us about 59.4 million in federal Medicaid match of Medicaid funds. And that's 59.4 out of a possible 133, right? So the goal is for us to get the entire 133. Medicaid, of course, is health insurance. And some of these people, when we're talking about COVID, I mean, I think one of the issues is people are not, they're hesitant to go to the doctor. They need to be covered, and so we're going to have to find a way in our upcoming session, I hope, or as soon as possible to make up the difference between accessing 59.4 and accessing the entire $133 million of Medicaid, so that we can ensure that, that income is not the factor of who's going to pass away from COVID, who's not going to go to the doctor fast enough, who's not going to be seen, and that we're going to make sure that anyone eligible can be covered and they can have access to medical care that way. So those are the two big ticket items, I think, that we've learned since the budget was passed, and we still have not learned how this earned income tax credit is going to come in, but I'm happy that the child tax credit is being distributed. I want to commend Revenue and Taxation for that. So that's being distributed in advance of even filing your tax year 2021 return, right? They're paying out child tax credits. And we don't know how the earned income tax credit is going to come in, whether they're going to give us the money in advance and tell us to use it to pay out, the credits themselves, the refunds, or whether they're going to give it to us after we've paid out these refunds. That's why the more money we can put into the refund account right now, the faster we're going to be able to pay out all taxes, including earned income tax credits, beginning, January. That's the first day you can file a return, right? So that's what the goal is. And I think just it's cash, it's their cash. And I would like to get them to them as soon as possible. Pending any other ARP plans or any other federal, infrastructure money or childcare money, all of that. I'm looking forward to that. The details of those also, being discussed. And
is it coming, Madam Speaker?
Yes.
Is the plan coming? Is it coming out? What did you hear?
Did not hear a word, unfortunately. No, we've asked. So I don't know. So right now, if you look at what happened yesterday's hearing with GMH, so we're learning from GMH that they're going to get money, and I'm going to have to continue to follow up with this. But we did put a reporting requirement in that in November, they have to report. But of course, we needed to know this prior to doing a budget for FY22. I think we need to know this now so that we can give some assurance to people as to how, what everyone's looking at. Businesses, I think, need, if we're going to stabilize our economy, despite, the very uncertain times we are in, we just need to give this in a plan where we can all plan around that, right? And we can alter our businesses, we can alter our own individual, financial situations based on, what use this money might go to. For example, if the new bill's going to cover childcare, then, mothers can plan on getting back to work. Mothers can plan on, not having to put that type of income aside to pay childcare. All of it. It's all, going to help us to revive our economy. It all works together. So the more information, the better. You know that.
Yeah, well, I mean, Madam Speaker, the congressman has been coming out with these little blurbs, I mean, going back months about what we can use this American Rescue Plan funding for. There's the premium pay for the private
Yes.
sector workers. There's the, child care funding. And so when you talk about planning, you're absolutely right. It's like, how do people who are anticipating, because of these things the congressman puts out, that they might be on the receiving end of some of this assistance with the ARP, but I mean, we're just flying in the dark here. What he says we're able to do with this money, I mean, obviously he would know, he's the congressman, right? But we just don't hear anything from the governor, like zero. PUA ended, and there was like nothing. She didn't have a message to PUA, she didn't have a press release, she didn't have a plan about what we're going to do to keep these people from.
Has anybody asked, okay, so if you're not going to give us a plan, tell us what you've already spent the money for.
And
And
that's the other
really,
thing,
300 million, she's dead set, I'm going to do this hospital thing. So,
Well,
really,
we
it's
did
300.
ask, of course, during the budget, we did ask Mr. Byrne exactly what has been spent as of that date, and so he did give us. And there were only the two items, I think, at that point. It was the RISE, and it was the money that went to GITA for the small business pandemic grants.
But then before
And,
that, there was also the quarantine.
bereavement.
They paid some bereavement fund. They paid for some quarantine costs. So they've spent a pretty decent chunk of that money. But I guess they're waiting till November to report it.
Well, yeah, that's not been reported. That was not reported by Byrne that day. It was my understanding a lot of that was used. They used CARES money for those things and other federal funds.
No, she was pretty specific. That
Yeah,
it
we
was,
have it. We-
ARP
For
because
the
she
bereavement. For
yeah,
the bereavement.
yeah, because she came back from her Washington,
Yeah.
D.C. trip, and she
yeah,
held the
no, you're
press
right.
conference, and she said, I spent it on this and that, and so.
That's right. I take it back. She did during her press conference lay out a couple of the other items, which were not discussed by Mr. Byrne. Yeah,
Right.
that's correct. I remember that making a list that day of the other items they were spent on. But no, unfortunately, and I think we should all just have an understanding. A plan, of course, can be changed. And so it doesn't have to be perfect. Our plan was not perfect. No plan is perfect. Even Congress's plan as passed is not perfect. But we just have to get close to that. And the only way we're going to get closer to that is by discussing it. I think, showing it, and let's discuss it, and let's make it as, better if possible.
Yeah, I just feel so bad. Like, what does it got to take to get this plan? I mean,
There's
we've
no
got
plan. I don't think
hundreds
there's a
of
plan.
people every day testing positive, and the deaths just keep increasing. So
Yes.
I don't
The
know.
deaths are very, of course, concerning. This is hitting everybody around us. So there's no avoiding it at this point. There's no avoiding, knowing. We all know someone who's tested positive. We know entire families who are testing positive. We know households who are just really being traumatized because of the implications of testing positive. You have implications for work, for school, of course. You have implications for, the elderly in the house. You have to either separate or, I had to follow up on the isolation facilities because I was getting calls from people who couldn't seem to access isolation facilities fast enough when they wanted to get in there and separate themselves from their families.
Mm-hmm.
And so public health assures me that they do have a process, but a lot of these processes, it's like it's got to get to the one person, then they've got to clear it, and then so it's just time consuming, and so that's an issue for me. The longer we have COVID positive people staying in a house where they know they cannot isolate, that's very concerning. So we need to be very quick in getting them to an isolation facility, which we do have right now. The government is paying for isolation facilities.
Yeah.
I just want everybody to know that as well. So if you're in that situation, please, call public health and avail of isolation facility. So if you want to separate from your family.
I'm
during
just
this time.
wondering why, though, Speaker, we haven't seen all 15 senators go down to the legislature and ask,
Luke.
what is the plan? Like I said, we have hundreds of people testing positive. People are dying every day or every other day. What are you going to do? I mean, why should we have to beg for her to come up with the plan on where she's spending all this money, or what is the plan to spend this money? I don't know. I am really upset and frustrated that we have not heard crap about this. And she's had this money since, what is it, May, July? I'm surprised you're not down there by now with everybody.
I think they just wore us.
I've
They
been
wore
down
us
there
through.
as much as I can. I do whatever I can, whenever I can, and I'm not giving up, Sabrina. So don't give up. I mean, it's not I agree. We should not have to beg. No one should have to beg. The people of Guam need some assurance. This is always been the priority. It's like, we're not doing this for any type of political anything. It has to be to give them some kind of assurance of how they're going to move forward, right? People are trying to make decisions now as to, whether they even can go back to work, or whether they're going to, not be able to, what type of work are they going to be able to. We talked about, we did some in the budget where we tried to increase these programs where we're going to do the retraining. And I think those should be immediately implemented types of things, so that we get them on them without any gap between PUA and this new, like an internship where you get paid a stipend to learn this other and that type of thing. So yes, I agree with you. And
Madam Speaker, I don't want to interrupt, but I have to. We have a lady on the line here who wanted to share a story relative to exactly what you were just talking about with COVID positives and the isolation. Ma'am, thank you so much for joining us. Go ahead. Good morning.
Good morning. Buenas, Chris, Sabrina, and Madam Speaker. So I just wanted to call, I was explaining to Chris that, there were 12 people, in my family's household, and recently 7 of them tested positive, and it was literally like one by one by one. And we first found out, my brother had come home. He was feeling sick. He was able to get tested and everything. And, it's a huge family. And, like a lot of our families, we only have very limited rooms. And so there's 12 people in the house and maybe 3 bedrooms available. And so my brother was literally staying outside underneath the canopy. We kept asking public health, like, hey, can he go into an isolation facility? They were giving me all these different types of numbers. They said, oh, call the National Guard. Maybe they can help you. And we really were very concerned about, okay, well, is my brother going to have a place to stay and to isolate safely tonight? And so that was a huge, it was a challenge. And, he stayed outside the canopy for the entire day. He wasn't able to get picked up by public health, by the National Guard until about 7 or 8 o'clock that night. And because we had kids in the house, my father is 67 years old, he had to stay away. And long story short, over the next couple of days, more folks in the family started feeling sick. So we all, went and got tested. And, again, out of the 12, there were 7 that tested positive. My father, who's 67, we took him to Naval Hospital. He tested positive, on arrival. They said that he had pneumonia as well. But the following day, it was like, okay, yeah, you go home because we really don't have any space. And so, again, and we had siblings who stayed, in the room with my father as, their caretakers. And, he always needs someone there just in case, he needs water or he needs help to go to the restroom. And so there was really no way to properly isolate. And so Naval Hospital released him. We called public health and they said, ma'am, I don't know what to tell you. If Naval Hospital is saying let him go home, go home. So he ended up coming home. And then the following day, we took my nephew to go get tested. He is only 11 years old. He wasn't able to get, the vaccine or anything. He tested positive. He became really sick. And then over the next course of a couple of days, 4 more family members, they just kept getting sick. And so Madam Speaker, you said, hey, call public health, they can help you with isolation. And every single time we called, we tried to explain that, it's a large family. We have very limited space. We don't have anywhere for anyone to go to safely isolate. They just kept saying, oh, well, I'm sorry, there's no room in isolation. And, everyone in the family is probably going to get it anyway. So just stay together. And, hey, if people get sick, they get sick. Mm-hmm. And, so it's really sad because everyone who was able to get vaccinated got vaccinated and, their symptoms thankfully weren't that bad. However, we had my 11-year-old nephew, and then my two nieces. One is 8 years old and one is 7. And, they were feeling headaches. They were feverish. And we were really scared, but we didn't know what to do because, hey, public health said everybody just stay home. The whole family's going to get it eventually, and there's really nothing else that could be done. And so
Wow.
I'm sharing this because, I'm sure that, because there's no lockdown or, any increased restrictions, guarantee more people are going to get sick. And so if other families are experiencing this, I just want to know who should they call? Should they reach out to public health? Do they go to the National Guard? We were even calling like the isolation facilities directly, and it was a circle. It was a round robin. Very frustrating. I felt very blessed, because we could, we were together and we kind of prayed and, we got through it together. But again, there may be families that would be even more scared, who have never experienced anything like this, and they wouldn't know what to do. So any guidance, who to call, public health, that I think that messaging out to the public would be helpful.
Thank you for sharing that story. This is exactly the issue that I shared with the governor during our meeting, and I shared with public health repeatedly. In fact, we were getting so many calls that the 311 number was not working, first of all. So getting a hold of public health is an issue. I agree with her. And what she's describing is exactly what I'm describing. These households where the entire households are going to get, affected if we can't isolate them quick enough, for sure, and there seemed to be a hesitation in allowing people into the isolation, which I was assured was not the case. So, I'm glad she told her story, and I'm going to follow up
Ma'am, hang
again
on,
with
though. We're going to ask you some
I
stuff.
raised with the governor and with public health directly.
Ma'am,
you.
so I'm assuming you really pay attention, but this is week, is this week 9 of this thing?
8. You're saying
This is week 8 of this surge, right? And the numbers, they're crazy high. Just your story, I think, is a snapshot of what, even public health believes is going on in the community. But for them to say, oh, well, everyone's going to get it anyway, it kind of seems like that's where we're at because they just refuse to do anything to stop the spread.
You're absolutely right. And, how do we explain this to the kids? The kids are worried about, of course they want to go back to school, but, hey guys, you guys are sick, and so we could use a lot more education and resources to better explain this to children because, if they see their parents scared, their aunts and their uncles scared, they're just going to be scared out of their minds, and so it's nerve-wracking and, I'm with y'all. I listen to you guys every single morning and I just appreciate all you do.
Sabrina's speechless. It hardly happens. But yeah, I just feel like we've been abandoned. I really do. We had Dr. Berg on, and I don't give a damn what anybody says. You guys all heard that interview. He was basically saying it's not far off, and not the plan per se, but the virus and the spread cannot be controlled. And so it kind of sounded like he was of the everyone's going to get COVID anyway school. And from what public health is telling you, if that's the policy, are you freaking serious? Like, you're just going to leave us to infect each other? And, the unvaccinated to get sick and die? And I just don't get it, ma'am. It's, I don't know.
Very sad.
Yeah, go ahead. I don't know what to say.
I hope the governor's listening. I'll say that.
We will continue to call them and pretty much on a daily basis and let them know the stories that people are relaying to us. Then these are very real and situations. And I don't agree, Chris, that we should let everybody be on their own. And I don't agree that we should adopt any kind of philosophy that we're going to get some kind of immunity by letting everybody get sick and suffer. No, I don't agree with that. And we have a lot of resources to use. I just heard yesterday somebody's talking now they're going to finally send out oximeters with the people who test positive. We've been asking for that for a year. And so I don't know what the resistance is. That's the baffling part. But anyways, I'm going to continue to push on my part. Thank you again to the caller who shared her story. And that's a very real story, one that I I have heard from several families, so I know this is happening in households, and it's very concerning. They should not have to suffer like that.
Yeah.
It's heartbreaking.
Yeah, heartbreak.
Yeah.
Okay.
But
Sorry.
thank you, Speaker.
Ms. Mossy.
And thank you.
Can I just ask one more question,
Yes,
if
please.
possible? So, I work on one of the military bases, and, of course, there was all this talk about the summer surge. Sabrina, thank you for, the entertainment whenever Chima comes on. Those are always some tense and interesting conversations that, we appreciate, because it kind of gives us, it peels the onion back in a sense. It gives us a sense of, hey, what is our government really thinking? But, I would love to see, I've got so many family members who work on base, and many of these family members have actually been infected with COVID. They've brought it home to their families, and it's taken down entire households. It's not just, my household. I've had other family members in other households who've all just been sick and have all had to just kind of figure it out and isolate at home. And one of the things that, we're seeing is a lot of us, have been exposed, on military bases, for instance. And I understand that, the bases, they control what happens on the installations. I understand that it's completely separate. But I'm hoping that, our governor, our leadership can work a little more directly with the military leadership on Guam and just say, hey guys, this is very serious. And, I guess try, if possible, to ask for more accountability, although they're not mandated to, be held accountable by our local government. If we're really trying to push for the One Guam initiative, it would help ease people's minds, just because it feels like there are just completely different rules on base. Yes, we are supposed to be wearing masks. Not everybody wears masks, unfortunately, even though that's the rule. And a lot of it is because, we have plenty of visitors who are coming in, and, they don't necessarily understand how negative the impact has been on our community. And so I would just please plead, with our government officials to work closer with the military to make sure that, they're holding their folks to a higher standard, especially those who are visiting, who are not necessarily from Guam and who, are going out into the local community, and having a good time. And we want visitors, hey, military is always good and everything. We need them to follow the same rules that our community, our people are expected to follow. Yeah. That's all I've got.
Speaker, I know you got to go. Thank you so much for your time this morning. Wow.
Thank you, and thanks to that caller. See what I said? The people are so smart. They're very smart.
We have the smartest listeners.
Yes, absolutely.
Thank you.
All right, take care, everyone.
Okay.
Thank you.
Take care.
Ma'am, thank you so much for your call. I don't even know what to say. Bree, you have anything to say before we let her go?
It wouldn't be good.
Yeah.
But I really do appreciate you. I think we need more people, like you to come forward.
Yeah.
And tell your stories. Please, I encourage anybody that just heard what she had to say. If you've got a story you want to share, call right now. 637-0094.